I was asked to speak a little bit about the clinician entrepreneur and my journey and transition and how to make it possible. And I guess a little bit about me. I started, well, when I left high school, I wanted to spend my life skiing. And so I worked for a couple of years as a ski instructor. And then I did something that was a bit strange for a ski instructor. And that was to study and then to go to med school. And so I went through med school and I worked at the Alfred for about, 7 years now, but mainly as a ward clerk, and then since 2011 when I graduated as a doctor. And then I did something, again, that was a bit different for a doctor, and I moved into full-time, I guess, entrepreneurism as of January this year. And so I'm here to talk to you a little bit about making it possible. Now, it all started for me with a problem. And like Peter was saying, the problem is falling in love with the problem. And for me, that problem was the pager and my burning hatred of it and my desire to kind of abolish it. Can I just put a hand up if you identify as a clinician, if you are a clinician? So there's kind of a third of the room, which is great. And I don't know if you've had experience with the pager, but most people hate it. And the reason I hated it was because I'd get, the pager, sends 140 characters of free text one way. And then you need to go and get that, you get your page doing whatever you're doing. You need to stop, you need to look at it. Then if it doesn't have the information you need to make a decision or to prioritize, you need to go to a phone, try to call the person back. But in this example, just letting you know bed 23's blood pressure is low doesn't tell you a lot of information. And specifically, it doesn't tell me who the patient is or where they are, because I know the Royal Children's probably has about 8 or 9 bed 23s in the hospital. Doesn't really tell you what's wrong or the priority of it, because, how low is the blood pressure? And I don't have a way to get more information. And you just waste a lot of time trying to, get what you need. So the problem wasn't the hatred of the pager. The problem really was the inefficiencies with the technology and its ability to send information only one way, and really the variable quality of the pages that you could get. And I think a recent study last year performed in the States said that the average clinician wastes over 40 minutes every day due to the inefficiencies of paging technology. And that's something I wanted to do something about. So I tried to find a solution, and you can try to cheat, you can try to just get rid of the pager, damn pager, and fill it with smartphones. But the more I started to talk to people about it, there were a lot of issues. So one, is there good connectivity in theatre or an ED? Do your phones get black spots? Mine definitely do. Issues about governance and who's going to manage it, security, privacy, all these things that come up in the media. And of course, change. I mean, that's something that all, I know at least doctors hate. And even if it's for something good, over a period of about 12 to 18 months, I've been working with the project, and I found a way to kind of get the information that one needs. And it looks really scary, but there's actually only 5 bits of information you need to put on that piece of paper, and a lot of it's automatically filled in. But then you're able to get, apologise if it doesn't project well, who the patient is, what the UR number is, what ward they're on, the priority of the message, who's calling, what their extension number is, and as well as some information. And when I came up with this idea, I thought, oh my God, I'm going to be a millionaire. God damn it, I can just retire right now. And then the next thing, immediately after that was, someone's going to steal my idea. No, I can't tell anyone about it because it's so great. I mean, no one's thought about abolishing the pager before. And then it's going to be super easy because, it's just a simple web form that I had there. And I went to a bunch of tech companies. This is just kind of the top 10 on Google in Melbourne. And I was like, let's make this app. Let's make it happen today. And within about 3 days, I sat down with 6 different app development companies, and they were really excited about building it. And then I was like, oh shit, what do I do now? Like, if I've got a product, what am I going to do? I'm a ski instructor turned, junior doctor. I don't know anything about business. I don't know anything about, what to do. I've never really worked with medical administration before. And then became my journey, which is a lot slower, through kind of the, I guess, the entrepreneurial ecosystem. And first was meeting other people in the area. Through Meetup, my partner went away for about a month. She was on annual leave. And so I had a bit of spare time on my hands, and I went around and met all these different people in the entrepreneurial space. StartUp Healthtech here wasn't around at the start, but it's a great place to go and meet other people. Silicon Beach, Melbourne Silicon Beach, is kind of like a social drinks, but you can meet other people generally in the tech space. And then the best part, go to something like a startup weekend. And for those that aren't aware of what a startup weekend is, it's essentially over a period of a weekend, Friday through to Sunday afternoon, a bunch of people pitch their ideas of what would be a good product, then a group of people work together to kind of make that happen in a period of less than 48 hours, and then you kind of explain it and share it with the rest of the people. And sometimes companies and products are born from that. But the most important person to meet is the customer. And for me, that would be not the clinicians themselves, but the health organisations that would be implementing it. So the medical administrators, the IT staff, and so on and so forth. And they're the customers that are going to buy the product, but also importantly, are the people that are going to use it. So therein come your clinicians. And would someone actually want to fill out a form with like 20 different fields? You get like so much more information, but it's just a real pain in the ass. So anyway, so I spent about 12 months in that space meeting different people and trying it out, working part-time at York Butter Factory with Stu over there. I'd come in between kind of between 6 and 9 is usually the startup time, meetup time. So I'd go to a meetup between 6 and 9, and then between 9 and 12 I'd kind of puzzle away on my idea. But then the next part was to learn and really to listen to the customer, and then read a bunch of books, watch a bunch of kind of YouTube videos, attend a program to kind of, I guess, work on the idea. So what it is essentially Startup Weekend Next is a program whereby you come up with your idea, you share it with everyone else, you go out and talk to customers and see if people actually want to use it or buy it. And then I kind of learnt about some of the options available. And the option that I tried and am going down is the DIY option, do it yourself. But as Mahinda was saying at the start, there's lots of other options available, especially if you want to be a clinician, that's what you've always wanted to do. So you can partner with commercialization entities. You can work with, in the States, there are a lot of groups that work. There's a senior clinical, I guess, researcher that partners with an entrepreneur to then commercialize a product. Or you can just give your idea to someone else who's smarter that might be able to make it happen. But you have to be really stubborn because it's not easy. It's definitely not easy taking the entrepreneurial route. And you have to decide, is your idea worth pursuing? How much time are you willing to invest in it? For me, it was really difficult to be a junior doctor and start your own business at the same time because you're just not in control of your time. You're rostered, you can't kind of step out to take meetings or take phone calls or whatever. So it was either to me to become a consultant, kind of wait 6, 7, 8, 10 years, become a consultant, then pursue the entrepreneurial path, or to kind of take a break from clinical medicine and go with that. And ultimately, what are your life goals? And so, do you want to be the Richard Branson or the clinician? You don't need to do either, you can do both. And so I guess the steps for me to make it possible was find the problem, find a potential solution, meet lots of people, find out what you want to do, learn about it, decide. And for me, it was to become the clinician entrepreneur. So thank you so much for your time. What we're ultimately going to create is a smartphone-based communication platform to replace pages or to supplement pages. But if anyone has any questions or wants to discuss it, just feel free to contact me at any time. Thank you.